Okay, so now I want to invite Julia. Like we said, she is a master degree student from São Carlos, under my supervision to present her research based on SBNH approach. Julia, I will make your host. You can share your presentation. Okay.
Everyone can see?
Yes.
Yeah.
Yes.
Okay. So let's start then. So, as I say, I'm very grateful to be here and for the opportunity to present my project for Julia. It's a huge honor. And first of all, I brought here a slide for you to get to know me a little better. So I'm Julia, a 25-year-old nurse from Brazil. I graduated with a degree in nursing from the Federal University of São Carlos. And currently, I'm pursuing my master's in the graduate nursing program at the same university. I'm in the second year now. And a little curiosity about me is that I am passionate about making a real difference in people's lives through compassionate care. And I believe that even small acts and empathy can have a huge impact. So, as you know, I'm from Brazil, more specifically from the Botucatu city that is here, which is located in São Paulo state. In Brazil, we have a state is similar to the province in Canada, and São Paulo is one of our 26 states here in Brazil. And my city, Botucatu, is well known for for its natural landscapes and very beautiful. Here I brought a quick visual summary of how I got here today. So here, my first day as undergraduate student in 2019, I was just beginning my studies in nursing. And the second photo was in my research exchange in Canada at Brock University in St. Catharines, in Niagara region. I don't know if you know where is it. It was a very meaningful experience for me, both professionally and personally. And finally, here in my graduation in 2024. Everyone can hear me? Yes?
Yes.
Okay. Here I brought an image from our university and from our campus here. Our department is, I'm not sure, but I think it's here. So, as I say, I'm a Laís student since 2019, and I've been working with her, and we are work in urinary rehabilitation outpatient at our university hospital. And I've been part of our multidisciplinary team that provides care for people with urinary problems, where we work directly with patients from our healthcare system in Brazil. Here is our university hospital and some images from our group, our multidisciplinary group. And in 2023, I was welcomed by a profession whose working focuses on organ donation, transplantation, and nursing interventions. And this experience inspired me to find a theme halfway between urinary rehabilitation and kidney transplantation, and explore how nursing can support patients along this complex journey. So, following this path, I developed my master's project that we call it as mapping innovations in a hemodialysis sector, based on the stream-based nurse and healthcare leadership philosophy, and it is a multi-method study. So to introduce my team, we went from the urinary dysfunction to chronic kidney disease. And I decided to study chronic kidney disease as it can be a urinary dysfunction complication, and the patient often lives with multiple chronic conditions, e.g., diabetes and hypertension. The patient may face a psycho-emotional and social challenge, may need continuous multidisciplinary care and support, and may require hemodialysis or kidney transplantation. My study will focus on hemodialysis setting, so I was here for that. So the chronic kidney disease is defined by persistent kidney abnormalities for more than 3 months, and it is a global public health challenge that affects over 850 million people worldwide. It is strongly linked to diabetes, hypertension, and aging population. Is very associated with high morbidity, mortality, and healthcare costs. And in Brazil, it is estimated that over 10 million people are living with CKD. Here I brought some role of nursing in the care of CKD patients. Nurses are fundamental here for the care for this type of patients, mainly in the patient education, emotional and psychosocial support, clinical monitoring and assessment, care coordination, and promoting personal-centered and humanized care. So despite the growing number of patients living with CKD, we look at for studies in these areas, and we notice that there is a shortage of nursing research focuses on the person-centered care approach in kidney care, psychosocial and education nursing interventions. There is a shortage as well. And in my region and the surrounding region, this gap is even more evident. There are no local studies exploring how nurses can improve the quality of life of CKD patients. And this gap motivated the development of my project. So now, speaking about my project, the general objective is mapping interventions in a hemodialysis sector based on the SBNH-L philosophy. My specific objective is to map scientific evidence on effective nursing interventions aimed at the care of patients with chronic kidney disease undergoing hemodialysis treatment up to kidney transplant stage, and identify the needs, challenge, and strengths of the nursing team in the hemodialysis sector using a participatory approach. And finally, analyze and validate the findings in collaboration with national and international nursing professionals and researchers. The methods of my project. My project is a multi-method study combining a scoping review, a quantitative and qualitative research. It is based on the SBNH-L and will follow the steps of the intervention mapping framework. The intervention mapping framework is an approach that was developed as a reaction to a lack of comprehensive framework for health program development and aims to help health promoters develop the best possible intervention. So at the beginning, our plan was to develop my project until the step 3 for the intervention mapping approach that is here. But we just received a review from a founding institution, and they suggest me to just apply my apply my time here just doing the step 1 at my master's project, and later in my doctoral project I will make the step 2 and the step number 3. The step one will establish and work with a planning group that will work with the nursing staff from the hemodialysis setting, and we will conduct a needs assessment to create a logical model of the problem. I will say a little bit later more deeper about the logical model of the problem. The step number 2 go deeper at the findings of the step number 1. And the step number 3 is the designing of the program, the intervention that I aim to create to contribute in the hemodialysis setting from the hospital in São Carlos. So the step number 1 is the logical model of the problem, and we will focus on understand the local context. We will create a planning group with hemodialysis nursing staff from a hospital in São Carlos City. I will make a focus group and use the focus group technique to identify the local problem and the determinants. We are doing a scoping review to identify existing nursing interventions for patients with NCKD in hemodialysis setting. And the SBNH leadership, we will use both in the scoping review and the focus group, in the open questions for the focus group. So I brought here our Prisma from the scoping review, our preliminary results. We had 10,669 studies imported from the first screening. And now we are with 109 full text studies for review. So I brought some examples of our scoping review results, and I will share with you our preliminary results. Some example is this article here, a behavior nursing intervention for reduce fluid overload in hemodialysis patients, effect of massage therapy with lavender oil on severity of restless leg syndrome and quality of life in hemodialysis patients, the effect of nursing lead telephone follows up telenursing on depression, anxiety, and stress in hemodialysis patients. Nursing's experience in improving adherence to fluid intake and diet in hemodialysis patients. Effect of periodic nursing interventions on improving compliance behavior and health status in long-term hemodialysis patients. And the effectiveness of acupressure for fatigue alleviations in patients receiving hemodialysis, a systematic review and meta-analysis. So, oh, Jesus. Let me, I don't know what. Let me see.
Julia, no problem. I think you can explain. Okay.
Sorry.
Oh, no problem.
So, here, we found like a thematic categories from our preliminary results, and where we can put on like our findings in these categories, our articles in these categories for just visualize better. I found health education and treatment adherence, like diet, nursing, health education, the self-care and empowerment, like self-care with the AV fistula or things like that. The communication and therapeutic relationship, e.g. group with patients, and the complementary therapies, e.g. music therapy, acupuncture, acupuncture, and aromatherapy. And we would like to discuss this part. If you prefer, we can discuss a little later of my presentation. But we want to mix our results here, like health education, self-care, patient self-care, communication, and complementary therapies with this SBNH Leadership foundations. Going on, in my focus group, in the hemodialysis setting, I have about 40 nursing professionals. And to attract these professionals, I will take a coffee break to also break the ice and start the focus group.
Julia,
And
excuse me, sorry to interrupt you, but the slide, okay, now change. Thank you, the
now,
focus group. Please continue. Thank you.
and the professionals work in shifts of 2,000 hours of work for 36 hours of rest. So I will do more than one focus group, aiming to reach around 30 professionals. And we will also follow the correct, this checklist, 32 item checklist for interventions and focus group to don't miss any part. And my proposed questions for the focus group following the SBNH leadership are: number one, what are the main problems in the hemodialysis sector? Then number two, what are the main barriers to implementing changes and improvements in the hemodialysis sector? Then number three, what interventions or improvement would be necessary for this problem? Number four, what additional technologies or equipment would be beneficial to the hemodialysis sector? Number five, what have you done or know of someone who has done something beneficial or potentially beneficial in the sector? And number six, who could bring resource for such an intervention? And I thought to bring these proposed questions for the focus group with this BNA leadership, with the collaborative partnership, the uniqueness, the self-determination, and the goodness of fit. But I'm not sure if I am saying it correctly, and I'd like to know, I'd like to listen about you and your expertise in this philosophy, and that I can see if I'm going the better way in my
way. Okay. So can I give you some feedback?
Sure,
So
please.
thank you, Julia. That was a very thorough presentation. Let's go back to your objectives. So not the general one. So this is what you want to look at, the specific objective.
Yeah.
There's just a typo there. I don't know who you're going to present this to, but on the first one, you just have to, there's a typo on objective. It's minor, nothing major. Just if you have to present it to somebody more important than me, you might want to correct it. So here on this, was it this specific? What's your next slide?
My next one is the methods.
Okay, so go back to your specific. I think what's most important here is that you identify everything that you want to do specifically, but you have omitted that you are using SBNH as your framework. So I think that you should indicate it in here as well. So your last point that you have is analyze, and I'm trying to move your faces. Analyze and validate in collaboration with national, international researchers using an SBNH
Perfect.
leadership philosophy, because that's the lens or the glasses or the way that you're going to try to look at your study. So I think it's important for you to put it here. The other element that I wanted to highlight on is continue, change slide. So because the project design, because you put it on the other one, I would not put it here based on, because you put it on the other one. So I would not include it in your methods, because specifically you indicated that you're going to use it. This is going to be your framework.
Mm-hmm.
You could discuss this with Lais after, whether you want to do that or not, but this is just my feedback.
Yes, please.
You could continue on the next slide. So as I understand right now, the recommendations from, I guess, a study group or whoever reviewed your proposal is saying that for your master's, you're just going to be looking at step 1, and for your doctorate, you're going to be looking at the other 2 elements.
Correctly.
I guess I have one question that is not clear yet to me. Because you started your preliminary scoping review on specific themes, but your title is very general. So your title is Mapping Interventions in Hemodialysis.
Yes.
But your research, so if you go back to your research that you did, your preliminary research.
The title?
Not your title. Go continue on your the lit review that you did, the scoping review that you did.
Okay.
Okay. So I guess, yeah, go the next slide where you put your 4 themes. Continue. Next slide. There. So I guess mapping interventions in hemodialysis. I guess I find your title very big, and then you were very specific with your thematic categories. So it's hard to follow, because is it health education and treatment adherence? Is it did you try to match that with the strengths-based nursing, or is this what really came out of the literature? Because your title is very, very broad, and the research you found was very specific. So I don't know if you understand what I'm trying to say is,
Understood.
did you know how it is, we collect data, and then we categorize it. We try to put it in a theme. So I guess what I'm trying to get at is, was it that specific in the literature that it matches beautifully with SBNH, or did you bring it there? Because your title is very, very big, very large, mapping interventions. Because
Yes.
mapping interventions can also be accompaniment, right? Support. Could be providing physical and emotional presence. Could be very general, but you are very specific here. So I don't know if it's just coincidence. That's what the literature shows. And if it is, well, you got very lucky that you found the perfect SBNH philosophy. So just to be careful, like, did you pre-lead the data in the literature to fit your framework, or was it naturally there? Do you understand what I'm trying to get at? And Giselle and Laïs help me if I'm not making myself clear.
Yeah, I tried to fit the themes in the SBNH-L, so that is why I'm not sure if I'm
Yeah.
doing correct.
So you just have to be careful, because otherwise it will be the research you could, when you present this, and I don't know anything about Brasilia and how they review, but I know that, if you're reviewing the literature, you want to make sure that whatever you're reading is coming out from the actual literature, and that we don't pre-categorize it, because we want to make sure that our theory is validated.
Yes.
Does that make sense, what I'm saying? Help me, Giselle and Laïs.
Yes, sure, it makes sense for me, Julia. I'm seeing her face. I believe she understood too.
Yeah, so I don't want to discourage you. I'm just saying to be careful,
Yeah.
because you could work very hard in the next year or 2 years, and then when you get to your doctorate level, they can start questioning this, and then you'll have to maybe start all over again. So I'm just questioning whether your scoping review was really, like, the articles that you read, did they really say health education and treatment adherence? Did they really say self-care and empowerment? Did they really say, because if they didn't, then you could be critiqued as as guiding your research, like you're zeroing into your research right away,
Okay.
versus I've read 10 articles. The 10 articles say A, D, E, and F. And then, you know what? The themes out of these categories are this, and this. Oh, you know what? They align with strengths-based nursing. Versus, oh, this is strengths-based nurses, so I'm going to put it in this way. So you just have to be careful, and maybe this will be perfect but I just am cautioning you, and I don't know who your research reviewers will be, that they could see it as, oh my gosh, look at this, already a preliminary scoping review, and right away, boom, everything matches.
Yeah. No, I think I will go deeper on my articles and the final screening, and I will make it will make more it will be more clear for me.
Yeah. And I don't know, I mean, I'm not here for the research component. I'm here for the SBNH. You have your experts in research. But I don't know if you use an Excel sheet when you review your literature and you say article this is the population, these were the concerns, these are the words that they use, and then put a line that says, oh, it could align with SBNH. Like, so you keep track of that, your raw data, so that you have it with you all the time. And that allows you to say and think deeper. Did I overanalyze because I really wanted to fit the SBNH? Or reality is, on this page of this article, this is what they said. So you can always go back and justify it if you keep track of your literature readings that you're doing. You're probably already doing that, and I'm not here for the research process. You have Lais for that, but just to be careful that you keep that, especially that you have a vision for you to continue into your doctorate. I would not want you to waste all this time and then have to start all over again.
I guess that the previous meeting that Julia was with us, we just discussed some part of her project, especially about this part of the pillars and values of strength-based nursing. And we asked her to bring this for this meeting with you, because that's something was really intended for us to get your feedback, Leah.
Yeah,
perfect. And I guess, Julia, what Professor Leah was telling us, maybe it's good to review, because just the preliminary findings that you're presenting, review and use the thematic categories more based on the data. Even it's not the same words like we have in our philosophy, SBNH philosophy, but that's a really good point brought by Leah, because that's something we don't need to force to fit into that category. But when we are interpreting our data, probably we could mention at least some alignments with the values and pillars, right?
And I think what is very important is that you're all doing listen to the other researchers, but the research that you're doing is super important. Why do I say this? I say this because many nurses are already using an SBNH-L approach. They just don't know how to fit it in. So if you start with very foundational information and you start right away with words from the approach, you're losing a big audience of a number of nurses who are using different terminology, and they will not see the alignment. So you're going to be missing a big gap there. And I think maybe you're disappointed in what I'm saying, but I think it's important for you to go back to the articles and use the language that's there, because then that makes it authentic. It makes it authentic in the sense of, Julia did 10,000 reviews. You're not going to do 10,000 reviews, but Julia did 500 reviews. In the 500 reviews, this word keeps coming up all the time.
Yes.
Okay? This word is this word in strength-based nursing. So that nurses, when they're reading it, nurses, researchers are going to say, we are using SBNH. We just have not been using it in the right terminology. So, because when you read something or when I read something, we have to relate to it, make it ours, right?
Mm-hmm.
So if
Yes.
I see regular words that I use all the time and then say, oh, I see it, this is what I do. Oh, I really am using strength-based nursing. Then you get people to believe in it because it's what they do on a daily basis versus convincing them that this is what you should be doing.
Yeah, I got it.
You got it? So
Yeah.
all I'm saying is just to go back, I'm gonna have to leave in 5 minutes, sorry, but just to go back and review a few articles. I'm not asking you to review all of them. Just review a few articles and think about what I'm saying, and then maybe make an alignment with the terms in SBNH.
Maybe at the sorry.
No, go ahead, go ahead.
Maybe at the data extraction, I could add some line with the words from SBNH, and I can see if it fits or don't
Yeah.
fit.
Exactly. So I would say take 10 articles. I don't know how many. Just take and do the exercise and see, in fact, if what I'm saying is, oh my God, it's true. They never really mentioned this word in the article. They mentioned this word. Or, no, they mentioned this word. So that's it. They mentioned this word. And then you do it for 10 articles. And if at the 10 articles, everything that you wrote here is reflected, then we're good. We continue. But I just don't want you to pre-fit something because you're trying to bring forth super important information and we don't want you to lose out on it because that raw data is what people will say, oh yes, it's true, nurses do talk about this word is said all the time. Oh well, now Julia is going to bring us to focus using on strengths-based nursing. And then you could work with your focus group, the people in your group. You can help them, even your nurses and everybody that you're working with, you can help them understand better. What does it mean to empower? What does it mean, goodness of fit? Because people don't use goodness of fit. People will talk about environment. People will talk about barriers, facilitators, right? So when you say goodness of fit, what is that? It's very theoretical. It's very academic. And people will dissociate because they'll say, oh, those professors. Oh. Then you have to bring it back to the clinical level because otherwise you lose people. And that's not your intent, I don't think.
Yeah, no.
Especially
I'm sorry.
Especially if you go back to how you introduced yourself, that you're passionate about making a change. If you're passionate about making a change, you have to go down to the people's level. And the people's level as clinicians is not goodness of fit.
Yes.
Okay? They have to understand you when you speak about goodness of fit. You have to go back and forth, not them. You go back and forth because if they don't relate to you, you will not make a change.
Perfect.
Okay.
Thank you
So I
so much.
didn't mean to make this a lecture, but I just maybe you didn't explain it enough. But just do the exercise. That's all that I would recommend. Do the exercise, maybe just 10 articles and see what I'm saying. Does it make sense? Or no, this was exactly what was said. If it was exactly said, Perfect. We move on.
Yeah, and if it doesn't fit in the SBNH, it doesn't mean that
It will fit. It will fit. And I'll tell you why it will fit. It will fit because it's a perspective that you put on, the lens that you put on. So it will fit. And if it doesn't fit, it doesn't fit. But
Yeah.
at least you're able to genuinely, authentically do that alignment. Because you don't want people to say you forced it into there. I never said that. That was never mentioned in the history, in the literature.
Yeah.
Because then you're going to have to go all the way back and restart. And I did not do my PhD, but that's a very discouraging process that I see in my colleagues. That, you know, going back and starting all over again, validate, and then somebody else comes and they say, that's not what it said. Go back. So I don't like, it's okay to go back, but what I'm saying is if you could avoid, sometimes going back a little bit is one thing, but when you have to go back a long place, it's another.
Yeah.
I really am sorry, but I have to connect at another meeting, at another international meeting for 2 o'clock.
Okay,
So I'm not sure if I could connect, but was this okay for the first meeting?
It's so good, Leah. I love to hear you, and it's so clear for us.
Okay.
Because we have the other meeting in this month. Did you remember?
Do we have another meeting?
29? Yeah,
29?
29, 1 p.m. for you. It's okay?
Hold on, I'm checking. Zoom meeting, the 29. Can we make it for 2 o'clock my time?
2 o'clock. Okay, for me it's okay.
For everyone, is
Guys?
it okay?
Yes, that's okay.
Okay. So Lais, you'll give me a new appointment for 2 o'clock?
Okay, yes.
Okay.
Thank you so much.
Well, thank you.
We
So
continue.
Julia,
Yeah.
Julia, good presentation.
Thank you.
Good beginning. So I hope I didn't discourage you, but it was very well done. You have a good vision, a good goal. It's a good plan.
Yeah.
Yeah.
Thank you so much.
Okay, so congratulations. Nice meeting all of you. I apologize, but I just want to make sure I connect properly.
No
Yes.
problem. Thank you so
Okay.
much.
Bye-bye, Leah.
Bye,
Thank
everyone.
you.
Happy holiday.
Bye-bye.
Thank you.
Bye-bye.
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 Mm.